I love being at the patients' homes. There's nothing quite like it. I learned so much about you and about your dreams and your fears and your desires, how you want to be cared for. I learned so much of that being at your home and listening to you and spending time with you and your family and your loved ones, hearing their voices and their concerns, and me as a clinician be able to help you directly, or maybe harnessing other team members to come in and to really support you in your time of need. As providers, we have such a unique opportunity to see where they live and how they live, not just purely their physical problems, but what is their social structure like? What is their environment like? How's the family? Do you have trouble with stairs, with getting food? Those are unique and important insights that you can get from making a house call. Well, I think the trust begins by you letting me come into your house. That's such a unique place to deliver care. And the issues that we talk about at home are often difficult ones, or can be difficult ones. Issues about goals of care, about end of life. That demands a lot of attention and thinking on my part, and a willingness to listen and negotiate with the family to find out what's important to them and how can I deliver care that is consistent with their goals. And one final comment I would make is that being at the home, I get a unique chance again to look at their prized possessions, their grandchildren, their hobby, their old wedding photos. That brings such a bit of humanity into medicine that often has been rather cold and calculating. That is so enriching for me as a professional and also enriching for me as a person. I think it's an exciting place to work. This is a place where you can really use the skills that you have learned in medical school and apply it. And you don't have the ability to rely on technology as much as you would say in an emergency room in a hospital. You really have to be an excellent diagnostic person. You have to really know your medicine and then apply it in an appropriate way within the context of the patient's desires and wishes. And it is terribly rewarding professionally because you are truly a clinician using your clinical skills, and it's rewarding personally and professionally because you get a chance to make an impact in a patient's lives at a time where they really need help from a provider.